Hey guys, welcome back. Danny here with Athletes Potential, and today we're talking about the knee. In particular, pain in the front of the knee, right? We know this is such a huge problem in the CrossFit community, the running community, and the tactical athlete community that we want to address kind of some simple ways that we can kind of work on cleaning this area up, right? And I like the saying, where the rats get in doesn't necessarily mean it's where the rats are going to chew. And what that basically means is just because you have pain in your knee doesn't mean that it necessarily is coming from the knee structures themselves. Today though, in this video, what we're going to do is talk about how to actually work on the knee itself, right? So the knee is a pretty simple joint. The knee is a hinge joint, right? How often do hinges wear out indoors? Not often. I have a 100-year-old house that has original hinges on one of the doors. So this is something that for a lot of people, when we have knee pain, the knee itself is not necessarily the problematic area. It could be coming from the hip or the ankle. But we do find people that irritate their knee, the structures behind the kneecap, maybe where the kneecap and the femur, where they are supposed to slide well on each other, maybe that gets a little bit junky. And that's what we're going to show you how to work on today. Really simple. All you need is a gym towel, pair of shorts, something that you can roll up, and your own hands. Okay, so this is what's gonna happen, the setup. So first things first, this is a pair of shorts. You can take a gym towel, you could use the same thing, and what we're gonna do is we're gonna roll this up nice and tight until we've kind of formed a little cylinder almost, right? This is gonna go behind our knee. So if we sit down on the table, we take the towel or the shorts, we're going to put it behind the knee, and we're going to do what we call a gapping technique. So you can do this sitting, where you're actually going to take your foot and you're going to pull it back towards your butt. And the point of this is to try to force the knee into flexion with some pressure that kind of ends up pushing the tibia and the fibula forward, the bottom part of the knee forward, to kind of open up or gap the knee. So you can do this here. You can do this on your back, laying down, pulling that foot directly back towards the butt. And we want to just pull, hold for a second, let it relax. Pull, hold for a second, let it relax. We'll do this between 30 and 50 times, okay? And you should feel kind of some gentle pressure to the front of the knee. The last variation we can do with this is actually taking this and putting our foot down flat on a table. So the towel again behind the knee, we'll put the knee down, and we can actually load the butt overneath or over top of the foot and gap the knee. This is a little bit harder variation. Some of you may not be able to do this without pain. If so, stick to the other two techniques. So just load your hip down, let it relax, load your hip down, and let it relax, okay? So 30 to 50 of those. Here's the second part, okay? So what we're gonna do is a self-administered soft tissue release, we could call it that, okay? So we're gonna take our pant leg, we're gonna expose the knee, and what we wanna do is actually let the knee relax, find out where the top of the patella is, okay? So the kneecap, which is right here, you can feel where the actual points of reference are. So there's kind of a flat top area where the quad or that thigh muscle connects into the quad tendon and then into the patella or the kneecap, and then it goes down and it actually goes into the patella tendon, which is just below that, and then connects into the tibia or the shin bone. Okay, so what we want to do is try to let that leg relax, feel where the top of the patella or the kneecap is, and there's kind of a very kind of dense structure right there as you feel this with your thumbs, and that's called your quad tendon. So once we've found that, here's what we want to do. We want to straighten the leg out, put some direct pressure with our thumb against the grain of the muscle, or against the grain of the tendon, which would run, if it's hip to the knee, this is kind of north-south. We want our thumb to go east-west, so against the direction of that. So I'm going to kick my leg out straight, we're going to shorten that muscle, we're going to put our thumb down, we're going to hold pressure there, and then we're going to pull our heel back towards our butt as far as we can. Then we're going to let it relax, we're going to find another spot on that tendon, pressure down, you can put your other thumb on top of that one to really hold it there, and then pull that heel back towards your butt, okay? So we're going to kind of repeatedly do that as we work around the quad tendon, Pressing down, holding it there as we pull that heel back towards our butt, okay? So anywhere from the inside, where the actual medialis is, the medial quad muscle, to the outside where your IT band and your vastus lateralis come together. This is, all those areas would be fair game for this, and they're really good places to clean up because that quad tendon can get a little bit kind of matted down and stop us from being able to actually create good, easy movement there, okay? So 2 techniques for you to try. The first one is for the knee joint, opening the knee joint up a little bit. If you have a bit of an arthritic knee, that is a must-do for you. You should do that every single morning. The other one is more of a sliding surface, or what we consider a fascial technique. We want to actually get those structures sliding a little bit better on each other, okay? So give these 2 a shot. The first one, try to get 30 to 50 actual mobilizations or contractions and relaxations, or we're compressing the knee and letting it relax. The second one, try to get a good 2 to 3 minutes of thumb pressure with the leg extended, and then pull the heel back towards the butt to where we're putting the quad on more of a stretch. Okay, so 2 to 3 minutes of that, and give it a shot. All right, see if we can take some of this pain away in the front of the knee. Get back to training, and thanks for watching, guys.